Hello, today is a great day to save lives, and to help you understand the CPR and why we do CPR, I wanted to talk to you about a little bit of anatomy of the heart. Okay, so God gave us a beautiful heart, even though it's not shaped like the real heart in the human body, but this is my little artwork here. So the heart is divided into four chambers. We have the atrium, right and left, and the ventricles, right and left. And we also have an automatic pacemaker, which God has given us as an automatic where it beats our heart. Okay, and when that pacemaker fails, we also have little pacemakers also in our valves. So this is an atrium and ventricular valve, an atrium and ventricular valve, and then there's valves in the ventricular. The atrium fills up with the blood, and the ventricular part of the heart pumps the blood out to the body. So when we're doing CPR and saving someone's life, we are an artificial pump. We are actually pumping the heart for that patient that needs us. So there's a whole bunch of arteries and veins, in our chest cavity, and we got the pulmonary, veins, and we got a whole bunch of veins and arteries, circumflex, and there's a lot of veins and arteries all around in the heart circulating. But sometimes what happens is little clots form in these arteries or veins. In any part of the heart, we can get blood clots. And the muscle dies, is deprived of oxygen, so it begins to die. And it can cause major arrhythmias and actually a major heart attack. Okay, so the normal heart rate is like 60 to 100. And when this automatic pacemaker fails, then there's a second pacemakers in the valves, and they will be slower. It's a slower rate. So this becomes like 40 to 60 rate, and this is where we have our bradycardias and people with slow heart rate. Okay, and then we have in the ventriculars, and the valves also is another pacemaker, which is our last pacemakers, and they beat very slow, about 40 to 20 at a rate, and that's a dying heart. So blood is coming in through the veins, dumping into the heart. It goes through all the veins and the arteries. So the atrium is where the blood fills, and the ventricles is where the blood is pumped out to the heart. So this is the major aorta, which is also taking the blood out throughout the whole body and to feed our brain. As soon as we find a patient that is unresponsive, we need to act quick. So I wanted to show you some the rhythms that we also treat, and this is why we need to get the defibrillator to the patient as soon as possible, for cardiac reasons, because people also have arrhythmias that will cause a very chaotic, deadly rhythm. So this would be kind of like my normal sinus rhythm. Again, I'm not really an artist, but this is a P, a Q, R, S, T, P, Q, R, S, T, and it synchronizes, and its normal heart rate is normally 60 to 100 beats per minute. There's a phenomenon, and I'm going into the dangerous rhythms, and this is why we need to get the defibrillator quickly to the patient, because sometimes we can have a normal, beautiful rhythm, and there's a refractory. The ST segment is usually a refractory period where it's like a calm, right? And before the next beat. Well, sometimes an R on T phenomenon occurs, and the R wave ends up on the QS, and then it sends it into like a V-tach rhythm. We defibrillate these if the patient has no pulse. We also cardiovert them in the hospital with medication, and we override the rhythm and we'll shock it as well in a stable environment in the hospital settings. But if a patient has no pulse, they could be in this deadly rhythm, which is chaotic, and it's life is threatening. So we need to get the defibrillator to shock them out of that dangerous rhythm. Then we have course fibrillation. This is still a shockable rhythm. Is a deadly rhythm. It's chaotic. That means that the heart is just firing everywhere, and there is no synchronizing of the flow of the heart. It's just quivering. Okay, it's just doing its own thing. So we need to shock them, and this is a really good time still to shock. What happens is if we never get the defibrillator to the patient and it takes too long, they will eventually go into this fine ventricular rhythm, which is very hard to shock them at that point. And then it goes into a refractory asystole rhythm. So as soon as we determine that the patient is pulseless, we need to shout, help, help. We need to point at I'm sure there's bystanders everywhere. Okay, there's always going to be somebody that's standing around. Send somebody to call. So point to them, look them in the eye, and say, "Hey, you in the red, call 911. Hey, you in the blue, make eye contact. Get the AED, come right back. Call security, get the AED, and come back." Or you have your cell phone. Pull out your cell phone. Call 911. Have an idea of where you are. Okay? Because we need to get that AED. It's important for cardiac patients and to save life. So when you get the AED, the first thing that you do is turn it on. And then you follow the prompts. It will tell you what to do. Okay? So stay tuned. We're going to get into CPR. We're going to start with the adult CPR. And I'm going to show you what CPR looks like. And if you like our videos, hit the bell, subscribe, and leave a comment. Let us know what you are, any questions, or if you want more videos or more any understanding, please give us a call, 786-701-8843. And stay tuned for the next one when we get into adult CPR. Okay.